when we talk about kids in the hospital who've tested positive for COVID, are you seeing a lot of them are in the hospital because of COVID related symptoms, or they're in the hospital for something else and it's incidental that they tested positive for COVID?
During the first wave back in November through February, clearly a majority were incidental findings. They were there because they were in a car accident, or they were a very young baby with a fever, and so they had to be admitted to be observed just because of their age, and they turned out to be positive for COVID. And a vast majority of those didn't have any significant complications because of their COVID. That's different from what we're seeing now. In the past 4 to 6 weeks, we're seeing a majority of them being admitted primarily for COVID because they have COVID and requiring specific treatments. And now that's regarding the acute COVID. Regarding the post-COVID complication, multi-system inflammatory syndrome of children, those again follow acute COVID by 2 to 6 weeks. Those we saw during the first wave, and those were admitted specifically for their inflammatory state rather than being COVID positive. The first go around, the kids fared well, but this is a different they're dealing with a little bit of a different beast. The Delta variant, which is what 94% of the new cases that we're seeing in Leon County are Delta variant. We've seen a spike in the increase in the pediatric ICU admissions around the state with acute COVID. And when you combine that with the data that we have on masks, the biggest pushback I've gotten on masks has been it hasn't been scientifically studied. There hasn't been an actual double-blinded, placebo-controlled crossover study. And that, while that's true, and I admit that, what we know about masks, the information that we have on masks is there's a wealth of information that masks work to decrease spread of infection when it comes to a viral agent that's transmitted mostly through droplet transmission. We have laboratory data where they have clearly shown that the droplets are greatly limited in their release when someone has a mask on, when they cough or sneeze, or even just with their deep breathing. We know that in countries where masks were mandated by governments, or they're more of a cultural norm to be used during specific times, their death rates are lower. When you have states within the United States last year during the first wave, we saw once there was a mask mandate in place, we saw the risk of spread dropped significantly. And so when you put that all together with the high percentage of positivity in our community, the fact that it's a more virulent, more likely to make you sicker, and it's affecting children more, I don't know how you can make any other decision but to mask in order to keep the kids safer, physically present in school. So that's my position, and certainly that of the American Academy of Pediatrics. And yes, will the mask prevent the spread of every single case? No, nothing can do that. But will it mitigate and have the kids have a better chance of staying safe while staying in school? I think absolutely.
I'm going to add a little something to what you said. This past year, due to universal masking in schools, what we have seen is a tremendous decrease in influenza cases. And that's the other airborne disease that we deal with every year. Now, influenza by itself, the contagiousness of influenza is if one infected person is exposing a room of patients who are not infected and they're not immunized and they're unmasked. So 2 others will be infected from 1 individual. So the R value for influenza itself is 2. The Delta variant, the R value is 7 compared to influenza. So 7 people will get infected out of 10 uninfected people if they're exposed. It's that contagious. Plus, it's virulent, as Dr. Truman said. So I think the fact that the US saw much lower numbers of influenza, almost minimal last year, was due to that, to the masking of everybody, which was a nice byproduct, and decrease in overall respiratory infections in everybody except the very young, which was a different story, that less than 3 cannot mask. They're still going to daycare, then they get their respiratory viruses, even though that happened later than usual, again because of the extra precautions we took. And, as pediatricians, the way I approach parents when they come, and there's a certain number of parents who want to hear it from their pediatricians, and I'm very glad that they bring it to their own physicians, and they want to ask very pertinent and good questions. I mean, a lot of what we do in the pediatric practices, outpatient especially, is prevention. And a lot of that prevention is through vaccinations. I mean, we've got good vaccines for meningitis. We've got wonderful vaccines for measles, chickenpox, polio, and now for COVID. We're very lucky to live in a country where we have access to the COVID vaccine, and which was developed rapidly, even though a lot of the technology, a lot of the research to get there has been happening in the past 20 to 30 years. I mean, it didn't happen overnight. The science behind it has been evolving and has been utilized for other COVID, not the COVID-19, but the SARS-1 virus and the MERS virus. So all this that happened within 9 months of getting an available vaccine was being worked on for about 20 years before that. So there's a lot of good research, there's a lot of good science to make it possible, and it's been wonderful.
I'm a firm believer in the opinion now that one way or the other, everyone's going to develop immunity to the COVID-19 virus. It's either through vaccination or through getting the disease. And by far, the complication rate is infinitely higher if you've had the disease compared to the vaccination.